If your child has been a little more fussy than usual, drooling like a fountain, or gnawing at anything that is seen, then you are witnessing a major infant milestone, teething. Hey everyone, I am your Supe Dentist and welcome back to my channel. Today I am going to talk about a very exciting and a stressful event that every parent goes through. I remember my daughter's teething and it was one of the most memorable event for me and my wife. And not to forget, it was stressful too. So in today's video, we'll walk through what to expect, common signs and symptoms, and easy safe strategies for your little ones to get through this phase. So how do we know if it is teething and not something else? While every baby is different, there are some common signs to look out for. It is important to remember that teething can cause some discomfort, but it shouldn't make the baby severely ill. So what are the common signs and symptoms that we can see? Physical signs can be excessive drooling, and this can start even before the teeth appears. And because of excessive drooling, there can be rashes around the mouth. The gums can be swollen and red in color where the tooth is emerging. The child can have mild fever. The temperature shouldn't be beyond 101 degree Fahrenheit or 38.3 degrees Celsius. If in that case, it is important to take professional help. There can be behavioral changes as well. There can be increased irritability, lack of sleep, increased crying, and child can even avoid eating because of the discomfort. Baby can be seen scratching the cheeks or the ears due to pain. So what can we do as a parent? There are few methods and strategies which will help to relieve the baby's discomfort. Now the first one is a cold therapy. Offering the child something cold to chew on, like a chill teething ring or a cold clean washcloth to chew on. Now this will help in reducing the inflammation and hence reducing the discomfort. The only thing that we have to keep in mind that it shouldn't be frozen, because the frozen items can damage the gums. And make sure the teething rings that we provide should be BPA free, and avoid giving small objects like beads, as it can cause choking hazard and should be avoided completely. Second is the massage therapy. Using your clean finger, apply a gentle and continuous pressure on the teething region. Now this will help soothe the gums. Third is distraction. Keep your child busy or engaged by giving age appropriate toys to play with. Even change in the places can help in distracting the child and reducing the discomfort. Now it is very important to know that there can be rashes around the mouth due to excessive drooling. Hence keep their faces dry to prevent any rashes. And ensure that they are hydrated and fed well. Finally, when to give the medication. It is important that we consult our pediatrician or pediatric dentist before giving any painkillers or analgesics. Remember, the medicines are given according to the weight of the child and not the age. And avoid applying any topical anesthetic onto the affected area, as it is not recommended. Now you might be wondering about the teething timeline. Now, this can vary from child to child, but this is the general guide. In about 6 to 8 months, the lower central incisors erupt, followed by upper central incisors in 8 to 10 months. Then from 10 to 15 months, the lateral incisors erupt. Now this is followed by the first molar erupting on the back side of the jaw, which is then followed by canines and finally the second molars. So by the end of 3 years, your child will be having 20 deciduous or milk teeth. Now with the eruption of each of these teeth, some amount of discomfort can be expected, but this can last only for few days. If it lasts more than few days, then it is important that you consult a pediatric dentist. And that's it for today. If you find this video helpful, please share it with your friends and family and help me spread the awareness around the teething. If you have any doubts regarding the teething or the strategies, please comment below. I would love to answer all your queries. Please do not forget to like and subscribe. Thank you for watching. See you in the next one.